Good afternoon, my viewers. I'm sorry, please don't mind my present disposition. I've been writing since morning. As usual, my name's Dr. Basil Esemonu, the Medical Director of Madonna Health Services, Isinweke Ihitoboma. This is my little library. So there is something I want to share with you people. A woman wrote on my DM. This is just a sequel also to my upcoming book, Women and Menopause. So a woman wrote on my DM 2 days ago that for the past 18 months she has not been able to see her period. So she went to see her doctor, and after detailing her clinical history, so the doctor recommended a hormonal profile test. That's enzyme linked immunosorbent assay ELISA test. So when the result came out, she discovered that the follicle stimulating hormone and the luteinizing hormone profile, that's the FSH and LOH profile, is very, very high. Why the E2, that's the oestradiol is very, very low, signifying that menopause has come in. Because when the FSH and the LOH is very, very high and the E2 is low, it shows that the ovary has exhausted its follicles, and thereby menopause has set in. So when these facts were laid bare before her, so she finally came to terms that the menopause is knocking at her door and that she's properly into menopause. So she was like asking, what can she use, or is there any intervention that can be able to help reduce the FSH and the LOH? Because her doctor made it known to her properly that with the increase in FSH and LOH, she is going to be having the menopausal symptoms. That's the symptoms of menopause, which includes the hot flushes, the irritability, depression, other psychomotor syndrome, such as maybe anger, change in temperament, and what have you. So above all, anyway, she is going to have the major issue which is known to affect all menopause women. That is the loss of bone mineral density, so which can even be worsened by the presence of osteoporosis. Osteoporosis is a bone degeneration that is associated with loss of bone mineral density in both men and women. But because women normally have menopause, men do not go through menopause. So it is more common in women than men, even though it happens in men anyway, but the occurrence in women is much more than that of men. So therefore, that's why it seems like osteoporosis is normally attributed to women mainly. So with the onset of osteoporosis, her condition is going to be worse. So she was like, what can she be able to do in order to reduce the incidence of osteoporosis and help keep the menopausal syndrome at bay? So I advised her that the best thing she can do is to go for what we call menopausal hormonal treatment. Menopausal hormonal treatment, that's MOHT, which is formerly known as hormonal replacement therapy. So hormonal replacement therapy entails the use of estrogen in the form of ethinylestradiol, that's E2, with the progestogen, that's a progesterone. Normally, the two are usually employed in order to alleviate menopausal syndromes, especially the hot flushes. And the intense sweating, that's perspiration. More especially even at night, there may be night sweats, as well as even lack of sleep and other psychological issues that comes up with it. So what I did, I asked her that she should talk to her doctor to place her on ethinylestradiol E2 with its attendant progesterone. Normally, progesterone is normally deployed in order to help shed the endometrium so as to reduce the incidence of uterine and breast cancer with only estrogen as a unilateral treatment. So in this way, it's going to help balance the FSH and the LOH, and also ensures that the incidence of breast and uterine cancer is highly reduced with the use of progestogen towards the end of the treatment. Like when you use it, like when you are using the combined oral contraceptive pills, sometimes doctors can also, give menopause women COCP, combined oral contraceptive pills, which contains both estrogen and progesterone in equal proportion, so as to ensure that a normal hormonal baseline is maintained, so that there won't be any risk of both uterine and breast carcinomas. You understand? So in that respect, when she employs this procedure, the FSH and the LOH will normalize, and then the flare-ups as a result of menopause will be greatly reduced. So this is just my advice to her, and I thank God. She told me yesterday that she went to her doctor, talked to her doctor, and the doctor also recommended what I told her. And she will soon be placed on the hormonal replacement therapy, or most recently menopausal hormonal therapy. So keep in touch always. This is just fallout from my book, from my research. So just keep in touch always, and I will also keep in touch. Please help me to subscribe to this. I'll be giving you the information that is coming from my desk at a piecemeal. So very soon there will come a time where we can open a forum where we can discuss some issues, dissect some common problems, or issues that has to do mainly with women, as arising from this book, because whatever I'm discussing here, whatever I'm talking about here, is based on the present book that I'm writing. So remember, the book is titled Women and Menopause. It contains 125 questions that menopause women ask. Different types of questions asked by menopause women. This part of female life, or will I say this part of this stage of female life called menopause, has instilled fear in many women, because of maybe the dread, the symptoms, the change, and every other thing that comes with it. In fact, it affects a woman's life and activity from all dimensions. So, but in all ramification, there shouldn't be any fear. There shouldn't be any worry. If you know exactly what to do, just like every other factor in every other thing in life, you need to prepare adequately ahead of this occurrence or stage in your life. Adequate preparation will ensure that you won't have any issues. So we recommend that from time immemorial, women should always ensure that they take calcium supplement, or even dietary intake, required dietary intake very rich in calcium, so as to continue to maintain bone mineral density and ensure that their bones are in good health, so that when osteoporosis begins to set in, the condition will not be as worse as when some worse than one who has not in the first place made any arrangement. So that's the issue. Thank you so much. We have another discussion again tomorrow. God bless you all. Please help me to subscribe to this. God bless you.